Next, we will hear from Dr. Monica Berner and Kate Duncan from the Healthcare Service Corporation. As Senior Vice President of Markets and Chief Clinical Officer, Dr. Berner is responsible for clinical policy and operations that improve access and support efficient delivery of high-quality, affordable medical care. Her co-presenter, Kate, serves as the Executive Director of Product Strategy and Management. In this role, Kate focuses on the member and how HCSC can improve outcomes and lower total cost of care. We are grateful they are with us today to share more about HCSC's Cancer Services and Support Program and their efforts to provide high-quality, holistic cancer care. Dr. Berner and Kate.
Thank you. And are you able to hear me? Okay,
yes.
Great. Well, good morning, everyone, and many thanks to NIHCM for inviting us to present today on what we see as such a critical topic that impacts all of us in the healthcare industry professionally, and quite honestly, most of us personally in some capacity or another. So what we'd like to do is share with you HCSC's approach to addressing such a complex, costly, heart-wrenching sometimes, and increasingly prevalent diagnosis of cancer in our populations. And what you'll see is that we've been working to implement a multifaceted approach to support our members over the past several years. So when you look at this slide, I think the first thing I want you to acknowledge, and that we've internally acknowledged, is a handful of things. And one of those is that cancer is not a singular entity, nor is there a singular approach to managing it. Every person is different. Even chemotherapy, I tend to see patients that think chemotherapy is chemotherapy. Everyone has the same, but it clearly is not. Secondly, as you just heard, cancer impacts all demographics. Certainly some more prevalent than others, whether it's age or race or different risk factors, but we are beginning to see new patterns emerge over the past several years, such as increasing incidence of colon cancer in younger people, which has, of course, resulted in some recommendations for earlier colonoscopies. Third is, and this is super important, third and fourth are both important. Cancer is not necessarily a death sentence, although I think people often feel that way when they receive the diagnosis. And last but not least, cancer not only impacts the person who receives the diagnosis, but their family, their friends, their coworkers, everyone that surrounds them. So for this reason, for all of these reasons, our organization has chosen to approach the management of members with malignancy in a holistic manner, both across the chronological continuum from pre-diagnosis to kind of post-cure, if you will. And you see that infused in the concepts on this slide, where we look at preventive care, behavioral health, pharmacy, medical and surgical support, partnerships with providers, and community initiatives. So we really are looking not only across the continuum of diagnosis, but across the continuum of where we can reach in and support our members. Next slide, please. So we'll start by talking a little bit about preventive care advocacy. And as a family physician, you can imagine that this particular component of our program is very near and dear to my heart. Plus, who doesn't want to either prevent cancer or catch it at its very earliest appearance to improve the outcomes and avoid treatments that like radiation, surgery, or chemotherapy, all of which bring their own set of risks and side effects. So for those cancers that have recommended screenings like colonoscopies, mammography, pap smear, chest CTs in high-risk populations, we typically leverage our wellness and condition management programs to send targeted reminders to our members, as well as reminders to their providers that are engaged in our value-based care arrangements. And we always consider our PCPs to be the first line of defense in cancer detection and prevention. As a wraparound, we engage our local communities. You can see a few examples on this slide. Mobile mammography units, state-specific cancer summits, and partnering with local American Cancer Society's programs such as transportation and lodging assistance. And then, last but not least, we also, over the past several years have sent out over 334 home colon cancer screening kits to members who have not met screening criteria by claim. So they're at risk and they should be getting the screening. So you can imagine all of that going through our U.S. postal system, but we've had incredible uptake. People, especially you can imagine during COVID, people don't want to go in, don't want to go to colonoscopy. This is an easy way for them to do a recommended colon cancer screening on an annual basis. Next slide, please. So now I want to dive a little bit deeper into how we engage and support our network of clinicians in the screening, diagnosis, and management of cancer. Currently, you can see on the left side of the slide, we have 3 different oncology VBC programs across our geographies, and they're distinctly different. In Illinois, we have an intensive medical home that incents providers on a per member per month basis for quality performance around advanced care planning, site of service, hospice, really kind of, again, not necessarily looking at what are the clinical outcomes, but what can we do to support the members and the families that have received this diagnosis. In New Mexico, we have a pay-for-performance program, which incents our oncologists to include psychosocial and tobacco screenings in their visits, perform medication reconciliation, manage ER and inpatient stays. So again, very, very different. I mean, we're really looking at how can we meet the needs of our local populations and engage our local oncologists. So we develop these measures and these programs collaboratively. And in Oklahoma, we have an episode of care model that looks at total cost of care and shared savings specific to a handful of cancers. In the next year, 2025, we will be rolling out what you see on the right side of the slide. So this will be across all of our current HCSC geographies. And it is a program that includes multiple cancer types. We'll be measuring multiple utilization metrics, and in particular, I'm fond of the quality measures, which are again intended to improve not only clinical outcomes, but quality of life for those members with the diagnosis. And we've got providers of all different sizes. Some are very small groups, some are very large integrated groups. Some of them year over year have performed fabulously, others not so much, and we continue to work and share our data with them because regardless of where we start out, we know by sharing data and collaborating, we will improve outcomes for those patients in those programs. So next slide, please. So we're going to transition here. You've heard me talk a little bit about how we work with our providers, how we work with our communities. But I'm going to hand off to Kate in just a minute here, who will share details around our cancer service and support suite of products and programs that are offered to our employer groups and other members. And you'll see, again, as I mentioned, that not only did we take a holistic approach around the continuum of services, but also around how those members are supported. And while I describe providers, direct member communications, and community support, Kate's going to do a deeper dive on the components of this product, including the care management, co-management, working with pharmacy, discharge planning, getting second opinions to ensure that members receive the right diagnosis and have comfort that they're receiving also the best and most up-to-date treatment for their diagnosis. So Kate, I'm going to hand it off to you.
Great, thanks, Dr. Berner. And I wanted to echo her sentiments. Cancer is personal. I think we all can think of an example. I myself lost my mom at the young age of 6 to breast cancer. So I personally kind of understand this, and it helps drive myself and our team to really continue to understand what we can do for the member and their families' lives. So as Dr. Berner said, she started us off. I'll kind of continue talking through our components of our program. So this is a key area, our Cancer Services and Support Program. You'll see that we have a variety of different areas here in this. It spans, really, this is when the member has unfortunately been diagnosed and we need to best manage their care. And so you see we do this in a variety of different ways. This is really holding the hand of those members through this journey, whether it's really helping them understand their diagnosis, managing that diagnosis through whether it's co-management of behavioral health services, social determinants of health programs. I'll hit on both BH and pharmacy in a minute. Also, ensuring that that member understands that diagnosis and is comfortable with the treatment care. We have and just rolled out recently a new second opinion program that offers members the ability to receive kind of an expert medical review, understand what clinical trials are available to them. And in cases where members may not even want a proactive second opinion, we're already looking at any rare and complex cancers so that we have a peer-to-peer review with that oncology, treating oncology, so that we're really ensuring that member is getting the right plan of care moving forward. And then you'll see we support and navigate that member through, what are their benefits, what resources are available to them, and how can we best handhold them through this whole process. We can go to the next slide. And I'll talk a little bit about pharmacy. So as Dr. Berner mentioned, right, chemo pharmaceuticals are a unfortunate but necessary component of our cancer treatment. So we have a pharmacy care management program, and this program is a medication therapy management program. It provides clinical intervention and outreach that leverages pharmacy and medical claims data, which includes mental health and their medications within their BH diagnosis, to identify potential adverse drug reactions. The intent is to identify quickly and intervene quickly if there is some sort of drug-to-drug interaction. And then we actually outreach to the treating physician for optimal dosing regimen. They also are looking to support members in medication adherence, support site of care redirection, to really ensure that we're optimizing the best possible medication therapy for our members in the most advantageous cost. Next slide. Given the cost and complexity of cancer treatment, we know that medical necessity review is critical to ensuring members are receiving the appropriate care that is also evidence-based in the right setting. So reviews that we have here are listed. It includes a variety of different areas, including advanced imaging. So we were mentioned earlier, CT scans, MRIs, PET scans. We also look at specialty drugs, as I just mentioned. We're looking at genetic testing, radiation therapy, as well as site of care redirection. So is that source of treatment the right place for you to get it, or are there potentially lower cost options for members and they're out of pocket? Next slide. Unfortunately, right, as we mentioned, we all know someone who has been diagnosed with cancer. So we know firsthand the mental toll that devastating news can have on an individual and their loved ones. In fact, according to the World Mental Health Survey, 1 in 3 cancer patients has a mental health condition. And with rates of major depressive disorder being 3 times higher than the general population. So it's critically important that we have an appropriate and comprehensive behavioral health program to meet all of our members, but especially members who are going through a cancer journey. So you'll see here a number of components that make up our behavioral health program. The first, of course, goes without saying, is that we have an extensive network of our behavioral health physicians. We continue to keep our foot on the gas here, lots of momentum in 2025 to really be able to address various niche needs of BH. So this is a key one for us. But our BH programs go beyond just our network. We have a comprehensive set of behavioral health resources, and this can span what that member needs in their journey. This can be whether members are simply exploring some troubled feelings for the first time using the free self-guided digital mental health resource that we have available to them, or perhaps they're grappling with the reality of the life-altering diagnosis and need to speak with someone. Or perhaps, unfortunately, they're at a point where they need some end-of-life legacy planning and they can speak with someone through our EAP program. Through all of their journey, we have a solution within our BH program to meet their needs. Next slide. So we've talked about a lot of things, right? I wanted to take a moment to really kind of bring this all together and say, what does this all mean, right? Like, okay, HCSC, you've got a lot of cool things in your toolbox, but at the end of the day, what does this really mean for a member? And so I wanted to take a moment to really kind of walk you through a journey of a member. And so we can look at Sarah here. Sarah is a 45-year-old female. She's a working mother of 2. And as Dr. Berner mentioned, right, because we're always looking at various information, we see her age, her gender, her past claim history, and we identified her as someone that needs a routine mammogram. So we sent her a targeted screening reminder. She received that communication and she called her doctor and she got her mammogram scheduled. Unfortunately, after the screening, she was diagnosed with stage 1 breast cancer. The new cancer diagnosis triggered our case management outreach and an HCSC nurse outreach to Sarah to complete an assessment, which included a mental health screening, as well as identifying any social determinants of health needs that we can address, as were mentioned on the first topic. The nurse also helped confirm that Sarah's providers were in fact in network, which is always, I know, a big question. It's something we want to make sure that she has peace of mind on. Given she's a mom of 2 little ones, Sarah was grappling with this news. And so our case manager helped Sarah find an in-network behavioral health therapist for her and her children, while an HCSC social worker assisted with her EAP and medical leave needs. A few weeks later, Sarah had some questions around the proposed course of treatment. She spoke with her case manager about it, where her nurse informed her that she has access to an expert advisory review. And so she was warm transferred to that second opinion partner. A peer review was occurred through the 2 oncologists, and they determined that this was the best course of treatment for Sarah and her family, which gave her peace of mind. Weeks later, following Sarah's chemo infusion, she was experiencing some nausea. Her HCSC nurse worked with the pharmacist to get Sarah an antiemetic prescription filled, as well as her treating oncologist who suggested IV hydration after treatments to avoid any unnecessary side effects and potential ER visits. After Sarah's treatment was complete, the HCSC team connected her with her plan, her long-term plan. She has a support group and encouraged active engagement with her therapist. She is now a cancer survivor and an advocate for others. So not all of our journeys always end up so happy like this, but hopefully this gives you an idea of how at every step of the way we strive to be there and hold members like Sarah's hands throughout this journey. So if you flip to the next slide, we'll talk a little bit about what was the outcome, what did we see from this? Given kind of the comprehensive nature of our oncology resources, Sarah and her family benefited from the support throughout her end-to-end journey. It began, as Dr. Berner mentioned, with preventive care reminders, which helped detect the cancer and treatment early, which really helped ensure a successful recovery. And the holistic approach we took with her health management enabled a broader care delivery and deeper trust and relationships between her and her case manager, as well as through her oncologist and therapist. And finally, having resources available to help her understand her care plan, make sure that that was the right care plan for her. It really helped empower her to focus on her health journey and improve her quality of life. So if we flip to the next slide, that is just one example. We wanted to zoom out and now say, what have we learned about our program so far? Because we're constantly learning, right? We're evolving, we're learning, we're trying to continue to learn and grow. And so everything hopefully you have heard today has really hinged on focusing on those goals on the left, right? It's all about, and these are things that we literally think every single day here at HCSC, but how do we best improve the members' experience, improve their health outcomes, improve their network access, and ultimately drive down the cost of care. And so you'll see on the right some of the actual outcomes that we have of this program. And so we know that we are in fact making an impact in our communities, which is really great. We see that of our cancer care management program, we're engaging 52% of the members that we're identifying. And of those, a good number of them are benefiting from the resources and connections that we're giving them. So 34% were referred to a social worker for any of their SDOH needs. 25% of them were referred to a behavioral health resource. Dr. Berner mentioned the effort that we've been doing to, while we always want them to get into the doctor, sometimes they can't, right? Rural communities, inability to leave the home. So within the 334,000 colorectal screening kits we've sent out, we're seeing a 5% of those returned kits have a positive test result. That means that we are in fact catching care earlier to individuals that may not have ever gone and gotten it caught at all. And then finally, as we look at our expert medical review program that I mentioned just recently got launched, it's still fairly new, right? It just got launched this year, so we're still assessing it, but we do see very strong historical results with our partner. And the goal is really that we're seeing that members are, their knowledge is growing in terms of cancer, they're making more informed decisions, and overall it's improving the quality of life for our members. So we can flip to the final slide. What I wanted to really land on was that hopefully you've taken some bits and pieces away from what we've been able to accomplish at HCSC so far, but we are not done, right? We are certainly proud of what we've accomplished so far, but we are continuously evaluating and innovating to be able to provide the most optimal support to our members, as well as meeting or exceeding what the market is demanding of us. And so in addition to all the items that you've heard about today, we are actively working on a couple things in the pipeline. So you'll see in 2025, we have some enhancements that are rolling out, including a new cancer care hub. The intent here is that we make those resources that we just talked about much easier to find and navigate for our members, because sometimes it is very difficult to find and not knowing where to go. We want to make that easy for members right then and there. We're also working on how we can best improve the support we provide to members who need palliative care. And while a little bit further out, we're also looking at how we can best support and advocate a strong survivorship community, make our short-term and long-term disability products more integrated within this cancer experience, as well as exploring the advances of genetic testing and precision medicine in this space moving forward. So lots more to come. We are so humbled to be here. We're excited to partner on this and very much appreciate the opportunity to be here. So I will pass it back to Kate.
Great. Thank you so much, Dr. Berner and Kate, for sharing HCSC's holistic approach to cancer care, the programs you're implementing now, the outcomes you are seeing, and really the vision for the coming years. Next, we will hear from Dr.